Good afternoon, and thank you for joining me for today's town hall. I'm Janice Scott, and always extremely proud to be your president and CEO. For over 2 years, Team RVH has been navigating relentless ups and downs of COVID-19, managing outbreaks and caring for critically ill patients to responding to ever-changing information and protocols. The pandemic has been grueling for our staff and physicians. The prolonged unpredictability has been stressful and emotional. Frankly, we are exhausted. You are exhausted. And while we are relieved to see the recent loosening of restrictions by the province following a decline in hospitalizations, we still need to remain ever vigilant and ready to respond as we anticipate there may be bumps along the way. This prolonged stress and anxiety of what might come next has created a significant strain on mental health. In fact, a recent Canadian Association for Mental Health study noted that half of the respondents say their mental health has worsened over the course of the pandemic. No one has been more impacted than healthcare workers. It was an industry under stress before the pandemic, and COVID has intensified that pressure. Today, we will focus on Team RVH's wellness, both mental and physical, and how we can support each other now and in the future. I'd like to welcome and introduce today's panel. First up, and no stranger to our virtual town halls, welcome back Kathy Clark, Director of Safety, Security, and Occupational Health. And a very special welcome to our next 3 panelists who are participating in today's town hall for the very first time. Emily Beaudrug, Clinical Nurse Educator for Pediatrics, NICU, and Child Youth Outpatient Ambulatory Services, and Emily is also a RISE responder. Mark Unwin, Manager Prevention, Screening, Patient and Family Support in our Regional Cancer Program, also a RISE responder and a member of the RISE recruitment team. And Angela Mcquaid, social worker in the adult mental health and addiction, and also a RISE responder. Thank you all for taking the time to join me here today. So let's begin with Kathy. RVH has partnered with Waypoint Center for Mental Health and Georgian College to understand the effects of the COVID-19 pandemic on the mental health of healthcare workers. Jesse McLean, who leads our research program, participated in the study, which was one of the largest academic health research collaborations ever done in our region. The study evaluated wellness and resilience from frontline staff from Waypoint and RVH, including 146 nurses, physicians, and allied health professionals. Kathy, what did the study find?
Thanks for bringing this up, Janice. We're so proud to have participated in this study, and it was recently published, which is also a great milestone. And you're right, you've noted that 146 of the 240 participants in total were from RVH. Most of our participants, and this is important to understand the results, most of our participants were nurses with less than 5 years in the position they were in way back in August 2020. And that's also important for us to understand some of the results. What's interesting from an RVH perspective is that 50% of our respondents actually showed no symptoms at all of what the study was looking for, which was evidence of depression, anxiety, and stress. That was a good news story. But the other half, 50% of the respondents, were symptomatic, and they were symptomatic on a range from mild to extreme. And you know, that's been an important thing for us to recognize in the time that has gone by since August 2020. And before I talk about that a little bit more, I want to mention something that was, I think, for me, the most significant finding around our own nursing staff here at RVH. And that was the statement that the study authors said very boldly that being a nurse is a predictor of a better quality of life and much better resilience to the what I usually call the vicissitudes of life, or the stuff that just happens. And I think that should just strengthen our resolve to know that when you are a healthcare worker, you come with either a particular personality or a suite of training that readies you for these types of crises. But in spite of all of that, a lot has happened since August 2020. I don't really have to tell you that, but the pandemic has been relentless. We've had Delta, we've had Omicron. The disruption to our lives has been relentless. The impacts on seniors in long-term care and children who are school-aged, relentless. And in the intervening time, and particularly in the last 9 months or so, we've also seen some demoralizing things happening in our community. We've endured protests right here on our own hospital property. We've seen borders blockaded about the pandemic mandates. We've seen some very significant unrest in our nation's capital, where some of us are struggling with the reduction in our provincial mandates. And now, on top of all of that, we're dealing with the fear and uncertainty related to the outbreak of conflict in the Ukraine. It's just a lot. And so the study has positioned us to really understand what was going on in August 2020, compare that to what's happened since then, and position us to really strengthen the resiliency of all of our staff. It's a lot. And I think what we know for sure is that we need each other now more than ever.
Team RVH. Thank you, Kathy. So we recognized early on in the pandemic, the need to support Team RVH's mental health. With support from the executive leadership team and members of Caring for You committee, we created the RISE, or Resilience in Stressful Events, the peer support program, and it began last June. So Kathy, tell us a bit about the program and how RISE is working to improve our mental wellness.
Well, I've got to give a great, huge shout out to you, Janice, because chairing the Caring for You committee was really the catalyst for getting this peer support program in place, and the support from the executive leadership team, I think, has been unparalleled in other hospitals in Ontario. And we launched RISE in particular because it's a program developed by Johns Hopkins, one of the best hospitals in the world. And we wanted to align ourselves with their learnings and their experience in a program that was already a decade in of maturity. And in June of 2021, we launched our version of that RISE program with tons of support from the Johns Hopkins teams, with an amazing 36 volunteer responders. We were just overwhelmed with the response from Team RVH to want to care for and listen. And I think listen is the key here. So since that time, these volunteers have been at the ready to take calls from Team RVH every single day. 10 hours a day, we are operating from 7 in the morning until noon, and then again from 3 p.m. until 8 p.m. And we have taken an average of 1 call a week. And while that doesn't perhaps sound like a lot of calls to you, it's more than Johns Hopkins had in their whole first year of operation. So we brought this RISE team of peers to Team RVH, I think, at just the right moment. As part of that, we also delivered individual copies of the Mental Health Continuum. That's a Mental Health Commission of Canada document. We've delivered that to every member of Team RVH. We keep handing it out at orientation. We've also expanded, as part of the whole RISE philosophy, we've expanded our critical incident stress management debriefs, and many of you have seen Gina, our psychological safety consultant. You've seen her out with our new lavender cart, which is just a further way that we are supporting the needs. And, I think what all of this has done, and what our RISE responders in particular do, is we let Team RVH know that we can see your suffering. We see it in every one of you, and we care so deeply that we are here to volunteer our time just to listen. We're not going to try to fix your problems. We can't make the pandemic go away or relieve you of the burdens that you are carrying, but we are here to come alongside you in your journey and help to carry that burden, even for a brief period of time. And that's what we are really so very proud of.
Thank you, Kathy. Yeah, thanks for this incredible work from you and, of course, your team, but also just throughout this whole pandemic. I know health and wellness of the organization is always top of mind for you and your team. And as we listen to you, we know your compassion has been a guiding light for many of us during this stressful time. So before I let you go, recognizing that physical health is an important component of our overall well-being, maybe, Kathy, can you address, as many are asking, when will the Wellness Center be reopened?
I am so glad you're asking this, because I'm getting that question, and Lee Gross is getting that question. And what I'm about to tell you is probably going to be just a little bit of a disappointment to many. We're just not quite there yet. And I'm going to explain to you why that is. Even though we see the province reducing mandates, and this is a little bit confusing, we're really still in the midst of the pandemic inside the hospital. And as it's impacting our staff, most importantly, I think that's what we need to understand. So we're still seeing an average of about 4 to 5 new positive cases in our staff complement every day. And that's just way, way more than we saw at any time up until Christmas. So we're not quite out of the woods yet. And that means that It's a little bit too early to have groups of people gathering informally in the wellness center where mask wearing is really, not a great aspect of working out. So we're just not quite there yet. And because we still got people coming back as early as they can when they've tested positive, we need to keep the wellness center for the isolated break space. Now, we're hoping that that's not going to be too much longer. And I just want to reassure you that this is on my radar, it's on Lee's radar, and it's on the radar for the Space Planning Committee. And we review it every single week. So stay tuned, fingers crossed, it is coming very soon.
Thanks, Kathy. May not be what some want to hear, but it's just better to answer the question. And of course, just being transparent about where we're heading. Mental health is a top concern for Team RVH. In last year's wellness survey, a whopping 80% of the respondents said they are worried about their own or their family's mental health. A crisis situation like a pandemic can have widespread, unanticipated impacts on our day-to-day work life, but also our home life. The members of the RISE team have stepped up and volunteered to provide confidential, timely support for members of Team RVH during stressful situations. Emily Bodrug is one of our dedicated RISE responders. And Emily, I'm told you jumped at the chance to be part of this project. Can you tell us why you're drawn to the peer-to-peer support program?
Hi, Janice. Thank you so much. And thank you, Kathy, also for the words that you had to say. Yeah, I totally jumped on this opportunity the second that I heard about it. I know leadership was awesome, and throughout the hospital, they were going around introducing what this project was and telling us about it. And right away when I heard RISE, I was like, okay, so what does this stand for? And I remember like seeing the posters go around and whatnot and looking it up and reading John Hodgkin's university about what the program was, and instantly I knew I wanted to be a part of this team. And the fact that it's also a confidential program, I thought that was also an awesome part to know that like this was being offered here right at our very own hospital here at RVH for our very own team members here at the hospital. So I know that this also was launched right in the heat of the pandemic, and when the pandemic started, it was super stressful throughout the hospital. Even before the pandemic started, it was stressful in this hospital. So to have this program launch right during this pandemic, I thought was super useful. So I knew I wanted to be a part of it. And I know, like I always say this to others, like, and you guys know what it's like working here at the hospital and being part of Team RVH members. Like sometimes we literally see our own Team RVH family more than our own families, especially if you're here working full time. So why not, just like you would care for your family members or your loved ones or your friends, I thought, why not be a part of this team where you can care for your team members here at RVH just like they were your very own family. And especially when they're all we're doing is taking care of patients day in and day out. And I feel like sometimes we forget that to take care of ourselves. So being part of this program, I just knew that we would be able to help care for ourselves and care for others. And I know it's super important as well to recognize our own mental health and recognize when it's okay not to be okay. And I know as healthcare workers, sometimes we can be notorious for putting our own well-being and mental health aside. And sometimes when we deal with stress, I just feel like we feel like trauma is normal and dealing with crisis is normal, and we deal every single day with stressful events. So by being a part of this team, I knew that we can help our own team RVH members care for each other and for one another.
Thanks, Emily. And I understand you've answered several RISE calls. So what's it like to be invited into someone's life like that? And in addition to your RISE training, can you tell us a bit more about the qualities that could make an effective RISE responder?
Thanks, Janice. Yeah, so I have taken a couple calls now, and the calls, I remember my first call when it came through, I was a little bit nervous, but honestly, like it wasn't as bad as I thought it would be being a peer responder, because these are our coworkers. We talk to each other just like we would talk to our own family, our own friends. So yeah, and I know the people calling are vulnerable, and I know they are in the crisis as well when they call. So by being a peer responder, we are there, like Kathy said, just to listen. We can't solve their problems, we can't fix it, but all we are there to do is to help and to listen. And the best thing I feel like being a part of this team is that we all come from different disciplines. So some of us are nurses, we have security guards, we have corporate communications, we have managers, we have doctors, like the list goes on. And so by having this wonderful, diverse, unique team of individuals, we all come with our own unique lived experience of what we've been through and what we do every day at our jobs. So the nice thing is when you call, it just depends on who's called that day, and every day it changes. Again, like you said, the schedule's morning and we do also the evening shift. So every day, no matter who calls, there's going to be a different responder on. And the nice thing is we all bring different outlooks and different perspectives and different attributes when caring for others. So it is nice to know. And the other thing is that we are all volunteers. So we are all here for the right reason. We want to be here. We're doing this on our own time. We're not getting paid to be here. We literally just want to do this out of the own goodness of our hearts. So, and I guess one thing we all share by being a peer responder is that we all just care and we all love to listen, and we get how important it is to respect confidentiality. So no matter what you tell us, it stays safe with us. We don't tell anybody, and even if we talk to within our own group, nothing by names or designation or anything is ever shared with each other. And even when the caller calls in, by no means do they have to share their name. They don't have to even share where they work. All we want to know is how can we help and how can we listen. So I think that's the best part about this program. Of course, if there's somebody ever that was a risk to themselves or risk to others, obviously we're going to make sure that they're okay. But otherwise, we're just here to listen, and we're here to care, and that's what we all share.
Thanks, Emily, and I'm sure your enthusiasm is indicative of the rest of the RISE team. So thank you for volunteering your time to help your coworkers. I believe there really is something very special. Something happens when colleagues help colleagues, and it says a lot about the team they work on, and of course in this case it says a whole lot about Team RVH. Our RISE team is scheduled, trained, and supported by Gina D'Antonio, RVH's psychological safety consultant and RISE team lead under the direction of Kathy Clark. And unfortunately, Gina was not able to join today's town hall, and in true Team RVH style, her RISE colleague, Mark Unwin, quickly stepped up to the plate. We know that before training even begins, the recruitment of suitable RISE responders is key. And Mark, you have been a member of the recruitment committee since day one. So Mark, before I ask you about how one joins the RISE team, I understand that one of the many things that attracted you to the RISE program was the opportunity to attend the training delivered by the RISE team leaders at Johns Hopkins, an American-based health facility. Why was that so important to you?
Yeah, thanks, Janice, and thanks for the opportunity to join the discussion today. The fact that the program was developed and studied by the team at Johns Hopkins, as Kathy and others have mentioned, and then successfully implemented at dozens of other hospitals is what attracted me to wanting to be involved in implementing the program at RVH. And after we had gone through the implementation phase, I was doing some reflecting on whether or not I wanted to become a RISE responder myself. And to be honest, I was a little bit nervous about the fact that I didn't have formal experience or education in this type of work, but I did really appreciate the opportunity to receive very practical training from a team of experts that have made this program a success at so many other hospitals. And ultimately, it comes down to learning some strategies and principles on how to respond to someone who is in distress or struggling with a stressful situation in their life. And while that's critical to being an effective RISE responder, it also has a lot of practical applications for how to have supportive conversations with anyone in your life who may be struggling right now. And based on everything that we've just talked about, there are a lot of people that are going through stressful events right now. So I took a lot of reassurance in knowing that there was formal training available from a team of experts.
Thanks, Mark. I'm sure you're terrific in this role. RISE started with a team of, as we heard earlier, 36 responders, and now you're recruiting more responders. So, Mark, can you tell us what the commitment to RISE entails, how someone can apply to join the team, and what the expectations are?
Thanks, Janice. You're right. And as Kathy mentioned earlier, the response to our initial ask for volunteers was outstanding. And we had so many dedicated people from across a variety of departments and backgrounds stepping up to help support the launch of this program, from nurses and social workers, members of our environmental services team, administrative team members, and also a number of physicians who stepped up, really highlighting the importance of this program to be available for our credentialed team members as well. So to answer your question, commitment. We're looking for people to volunteer to be on call for 2 5-hour shifts per month. The shifts currently are from 7 in the morning until noon and 3 to 8 p.m. The shifts may change as the program continues to grow and evolve, as we hope it will, but right now those are the shifts. There's also a monthly RISE team meeting that we encourage everyone to attend. It's a really great opportunity to connect with the team and debrief on any of the calls that you may have received and discuss strategies that you felt were effective with your peers. In terms of how to apply, you can search RISE on the RVH SharePoint site, and there's more information on the program. There's a role description for a RISE peer responder, so you can read more about what the role is. And there's also an application form that you can fill out and submit. We are looking for people to submit applications for this round of recruitment by March 18th. In terms of expectations, the number one expectation that the team at Johns Hopkins really reiterated to us is to show up and be present. So when you're on call, to really make sure that you're freeing yourself from other distractions, that you're focused on being present and responsive to whoever it is that's calling in, and to practice a lot of those skills and strategies that are taught through the program. So things like active listening, allowing people the space and time to talk, to not focus too much on providing immediate solutions or suggestions to people, and really providing a non-judgmental and understanding to response to whatever it is that they're going through.
Thanks so much, Mark. And I think we would be, if not the only one of the only hospitals in Canada who's providing this program. Maybe that's back to Kathy, I guess, but I see you nodding.
I think
yes.
Go ahead, Mark.
I understand that it's been implemented at other hospitals across the states, but we're the first in Canada.
Great, thank you. So as chair of the Caring for You committee, which endorsed the RISE program, I am so proud that so many members of Team RVH have already volunteered to be part of this initiative. And of course, we're really encouraging others to consider it. Our RISE responders are a bit like firefighters. They're waiting at the fire hall for that bell to ring and then call them into action. And when it does ring, and it will, what a huge difference each responder can make. So thank you to all members of the RISE responder team. I know you're just as exhausted as the rest of us, and yet you're willing to step up for your team. So way to go. Thank you. We have one more member of the RISE team here with us today, Angela Mcquaid. However, at this town hall, I've asked her to wear her social worker hat and share some practical advice on how we can practice self-care and why it is so important. Welcome, Angela. As healthcare workers, as been mentioned earlier, it is our nature to put others first, and we struggle to make ourselves a priority. But Angela, why is it so important that we take care of ourselves?
Oh, thank you, Janice, for having me here today. I think it is really important for us to make time for ourselves. Working in healthcare is so rewarding, but it's also stressful. And, at the end of the day, we've looked after our patients and their families, our colleagues, and we go home and we look after our own families, our neighbors and our community. And if we don't include ourselves in that mix, it can wear us down, right? And you cannot pour from an empty cup. So self-care helps to fill you up. So I think it's important to take that time. Often we think, I don't have time, I'll do it later. But later can't wait. We need to make ourselves a priority and intentionally plan activities and things that are going to restore us. And self-care can be a way to cope with the stressors in our life, but it's also a great way to build resilience within ourselves so that when change and challenges come our way, we're better equipped to deal with them.
Thank you. But it is easier said than done, isn't it? So Angela, can you give us some practical advice for some things we can start to do right now?
Yes, for sure. I think the first thing is to make it a habit to check in with yourself every day. We do that with people around us. We say, how are you doing? How's your day going? Is there anything I can do to help you? We need to ask ourselves those very same questions, and we need to listen and respond to what we need. And we need to when we look at self-care activities, I just want to highlight kind of 6 areas that I think we need to consider. I think the first one is certainly, as we've talked about, our physical self-care. So that's looking after our body, things that are going to improve our physical health by looking at reducing, sugar and carbs and limiting caffeine and nicotine, stretching, getting fresh air. Then there's our emotional self-care. So that's acknowledging and finding healthy ways to express our emotions. You know, it's okay to say, I'm feeling overwhelmed. You know, I'm feeling anxious. When we can name our emotions, we can have more power over them, and finding healthy ways to release them. So that could be through journaling, or it could be through music, and it could be by talking to someone. In terms of psychological self-care, that's around our mental health. So looking at, although it's hard, we sometimes have to unplug from our social media, limit our time watching the news. There's a lot of, negative energy coming from the news. So limiting that, and finding things that can fill us up in terms of maybe doing mindful activities like Sudoku or Wordle, or activities that exercise our brain in a healthy way. Spiritual self-care is important as well. So that's about nourishing our soul and nurturing our spirit. So things like meditation, guided meditation, or nature, being with nature is really healing. And just looking after yourself in that way, or prayer. Another area is social self-care, and that's one I think we've struggled with over the last couple of years, being a little more isolated. And as it's safe to do so and things are opening up, to get together with people, away from the screen, but in person, and so making time to connect with friends and families, and colleagues face to face, or just getting out in your community, just having that sense of community and connection again is really important. And another area that is also really important is workplace self-care, because we do spend a great deal of time at work. So knowing that you are making a difference, sometimes it's hard to see that, but knowing that you are, and it's important to take your breaks. A lot of times we just kind of want to work through them, but you need to take those breaks, get away from your workspace, from your desk, get up, walk around, go outside, or walk around within the building, but you do need to use your breaks and vacations, and to reach out for support when you need to, from your leader, from your colleagues, and of course the RISE is here for that as well. So I think that when we look at self-care, we have to consider all these domains of ourselves, but the bottom line is that you can't put off self-care. You need to make it a priority. And so if you don't show up for yourself, it's really hard to show up for other people. So yeah, I think it's just important to start every day with the habit of checking in with yourself and asking how you're doing and what do you need today to be your best self.
Great advice, Angela. Thank you so very much. And of course, thanks to the whole panel for sharing so openly and honestly today. I'm sure that everyone in the organization is really appreciative of your dedication and for being there when they need you the most. And today's conversation has once again reminded me of the strength and the power of this team. It's truly what's gotten us through the pandemic. Speaking of this great team, today we're celebrating the dedication and commitment of more than 400 members of Team RVH who have reached an impressive service anniversary. Speaking of impressive, I did want to specifically mention 3 remarkable milestones. Dr. Ken Baxter is marking an astounding 50 years at RVH, and Barb Leonard in professional practice and Connie Wood in clinical informatics are both celebrating 40 years of service. Now that's commitment. I also want to give a very special shout out to someone I work very closely with, Vice President Suzanne Legui, who is celebrating 25 years at RVH. Thank you for your leadership and dedication, Suzanne. On behalf of RVH's Board of Directors and the senior leadership team, congratulations to everyone commemorating a service milestone. And thank you for all you continue to do to make RVH a great place to work, to practice, and of course, to receive care. I received many letters from grateful patients, like this one recognizing the exceptional care provided by our cancer team, and specifically Dr. Matt Falwell and Dr. Isabel Lee. I am so thankful to have been treated by the kind, caring, and exceptionally skilled medical team at RVH. I received phone calls and very clear and explicit instructions prior to any of my appointments with Dr. Falwell, Dr. Lee, and the radiation therapists. My family and I are truly so grateful for the manner in which I was treated during such a scary and anxious time for us. The bedside care has honestly made a huge difference to me and how I am healing and how I feel about myself. I believe both Dr. Falwell and Dr. Lee treated me with dignity and respect and clearly understood the nature of my illness and the anxiety I experienced along the way. They both provided time for my questions and for just allowing me to express my concerns and fears of so much that was unknown to me. The radiation therapists were empathetic and sensitive to how I was feeling during the setup of radiation treatment and during the 5 days of therapy. They all honestly have made a difference in my life. Rhea Roy, the social worker, and the nutritionist were wonderful as well. Thank you to all for caring for me, PB. So thank you, Dr. Lee and Dr. Falwell, Rhea, and the whole team who participated in caring for this patient. You truly are making a difference in our patients' lives. And as I read that letter, didn't all of our values just shout out at everybody in terms of everyone living those values and being a values-based organization? I'm truly humbled to see that our patient satisfaction scores have risen yet again and are up to 76%. I mean, that's amazing. You continue to provide exceptional care despite the ever-changing circumstances you find yourself in. However, I'm sure we all agree that we can't sustain the provision of excellent care if we don't first, as Angela says, take care of ourselves. So let's take some of her advice to heart. Again, if you need someone to talk to, the RISE team are standing by for a completely confidential conversation. Sometimes all you need is someone who understands and listens, and that's the RISE team. So until then, until next time, we want you to stay safe and stay strong, Team RVH. Have a good day.